Welcome to the PRH video series on the mental health impact of COVID-19. I'm here talking with Leslie Robison. She's a clinical psychologist working at Palouse Medical, and we're going to be talking about sleep primarily and kind of chatting about other related factors as well. But we're very grateful to have you on the series. Thanks, Leslie.
Thank you. Glad to be here.
And you're sitting outside. It's a lovely day. It's a good thing to take advantage of. I'm in my cold, sterile office, and I'm very jealous.
Getting my vitamin D, getting my healthy moment.
Helping build up that sleep debt, I'm sure, too. Okay, so jumping in, broad question. What would you say are some of the go-to things that you think people should be aware of as far as possible COVID-related difficulties or impact or just things to consider with sleep?
Well, I guess, Chad, sleep is a huge topic. And it's one of those things that we kind of believe it's our given right that we should be able to sleep well. We don't view it as a skill, and it is a skill. And those of us who have had little babies know that we have to teach them to sleep through the night. And then we forget as we get older that we have to kind of continue to work on this skill. We have to teach ourselves to sleep through the night. And anything can disrupt it. And COVID, it's got people concerned, as you've probably talked about, financial concerns, job concerns, future concerns, your own health concerns, apparently toilet paper concerns. There's concerns everywhere. And at night, when we go to bed, all those distractors of the day disappear. And all those little worries bubble up. And at night, those things that bubble up interfere with our sleep. They interfere with our ability for our body to just kind of down regulate. I always use the phrase, the boogeyman only comes out at night.
That's good.
And, or if you're staying somewhere and you freak out in the night and then you turn on the lights, you see it's a coat rack. Okay. But when you have to turn the lights on, but all that stuff comes out when we're trying to sleep. And so we're seeing people with really messed up sleep schedules. People are staying up until 2 or 3 in the morning. They're sleeping till noon, or they're abbreviated sleep, napping a lot. Alcohol consumption, as we've talked about, alcohol consumption has gone up a tad, a lot. And that interferes with sleep. And so there's a ton of different ways. So we can get cognitive ways that our sleep gets disrupted. Our brain just won't shut down, all these worries. We get physiological because we may be not eating well. We may not be exercising. We may be drinking, all sorts of things.
Yeah.
And even watching TV more, sitting more in front of a computer. A computer screen will keep you awake and mess with your sleep just about as good as anything will.
These are all factors that are more relevant to day to day for a lot of people.
Yeah, phone screens are horrible.
So as far as, even though like what you're saying, obviously COVID's brought some unique factors that are affecting the things that might not be so exacerbated, but just in general, what would you say normal sleep is for the average person?
So normal sleep is anywhere, I would say 7 to 9 hours. And when you're younger, it's obviously more. And high school, college, it's the age where you've got the sleep of the dead, which is wonderful. And then as an adult, it's probably 7 to 9 hours. And it's all determined by what time you get up in the morning. So, and that 7 to 9 hours, interestingly, as you know, it's not solid. Most of us wake up a couple times in the night, and that's normal. So it's kind of finding what works for you, but we can get too much sleep too. When you get too much sleep, you're actually more tired. So it's in that sweet spot, right? Mine's about 7.5, right there. I get more than that, I want a nap. I get less than that, nobody wants to be around me.
Oh man, I'm with you. I'm 6 to 7 is my sweet spot, and I'm pretty grateful for that. So it frees up some time for me.
Well, and you have a little one, so little ones will enter spots of sleep.
Yeah, that introduces some variability. And there, I remember I had an attending once that had a really good cliche about the less time you can spend in bed sleeping and the more quality is, the better off. More sleep doesn't equate
Hmm.
to better per se. And so efficiency, like you're speaking to, is really important. Um,
Oh, and sometimes it's our perception of how well we sleep. We think because we woke up a lot in the night that we didn't sleep well.
mm,
Um, but we actually look at the amount of sleep and our quality of sleep. But think of, how are you functioning? Are you functioning okay? Yeah.
mhm.
And is your sleep really a problem? Probably not.
It's a good point to kind of be thinking about for people when they try to gauge that for themselves. So differentiating, kind of, you just mentioned about sometimes people look at falling asleep as a problem versus staying asleep. What's the big takeaways you might want people to think about when it comes to difficulties with onset falling asleep versus maintenance staying asleep?
Um, Usually when people have difficulty falling asleep, they're having a lot of times shutting their brain down.
Mm-hmm.
Um, and so looking at your environment, having a routine really helps. Uh, we respond really well to our routines. This is what we do with our little kids. We have, the whole to bed ritual. And as much as we don't like it, that is advantageous for us. And that helps slow your brain down, teach it the ritual of what it's supposed to do. Um, Meditation apps, there's some fantastic meditation apps out there that are for free that help you focus to slow that brain down. Not thinking, but maybe focusing on something.
Mm-hmm.
If people are in bed too long and they're not sleeping, their anxiety tends to increase. So if you've been there 10, 20, 30 minutes and you're not sleeping, get up, do something else. When we wake up in the night, um, that, that tends to be a little different factor. We tend to sleep in about an hour and a half chunks. So we'll sleep for an hour and a half, we wake up, we go to the restroom, we sleep for another hour and a half, we wake up, roll over. Um, and when we wake up, sometimes we get going. Or we worry, oh my gosh, I woke up, is there something wrong? No, no,
Mm-hmm.
you're normal.
Yeah, attributing too much meaning to that. Mm-hmm.
Right. And so sometimes again, I'll say at night, the boogeyman comes out and those little things become big. So sometimes writing them down in the middle of the night, think of a grocery list phenomenon. If I gave you a list of 7 items and tell you to go to the grocery store, you're going to sit there and try and keep them in your head so you don't forget them. But if I write them down, you're like, oh, I got the list. I don't need to remember. And sometimes our brain can let go of things in the night if we write them down, no matter how ridiculous they seem. Even if it's something you're going to remember, you write it down anyways because it's on the grocery list. And sometimes people are more likely to wake up in the night if they've been into bed too long. If you're going to bed too early, you might wake up.
Mm-hmm.
Sometimes waking up in the night is actually an indication that you're spending too long in bed.
Thereby, kind of the routine is off too. Mm-hmm.
Mm-hmm. Yeah, your body will get the sleep it needs, but if you're in bed for, as you use the phrase, efficiency, if I give myself 10 hours in bed, but I only need 7 hours of sleep, I'm still going to wake up and make sure I only have 7 hours of sleep.
Mm-hmm.
And I've got lots of room in bed for my brain to go.
Mm-hmm. Then you're up sometimes at that twilight hour and it's depressing and or nice,
Yes.
depending. Yeah.
Yes, it is never sunshine and lollipops and happy dancing unicorns at 2:30 in the morning.
Not in Pullman, I guess. Yeah.
No.
Yeah. So all things considered, sleep hygiene aside, and we don't have to go into that too much. Obviously, you touched on a lot of that. When would you say is the time when a person should consider meeting with their primary care provider to discuss medication?
So you've probably mentioned this in previous podcasts if there's depression or anxiety that is interfering in daily functioning. If you're not able to meet reasonable, I'm using the word reasonable, goals for the day. And as we know that there are people who during COVID believe they have to be Wonder Woman and Superman and do those projects they've never thought they've been, never been able to get done. I'm talking about normal functioning.
Mm-hmm.
Can you meet your basic needs of daily living? Are you starting to have some health consequences? Having the occasional bad night is pretty normal, but if it's happening more nights than not is a good psychobabble phrase we tend to use, right? If something is happening more nights than not and it's interfering in daily functioning, then is the time to talk to your doctor. But the interesting thing, I'll tell you this, is the according to like the internal medicine docs and psychiatry and family medicine, the first line of approach for sleep difficulties is visit your local psychologist.
Yep.
Cognitive behavioral therapy for insomnia is the number one approach. Meds are a secondary line.
CBT and sleep hygiene.
Yes, exactly. And I can say I do a lot of integrative work with Dr. Fosbach, and Dr. Fosbach now is pretty adamant about you got to do CBT before we'll look at meds. She prescribes sleeping medication much anymore.
Dr. Mehta, who's the pulmonologist here for the clinic network, we get a lot of referrals from him for kind of early, just like almost a rule out of kind of CBT and sleep hygiene to make sure it's not a factor.
Exactly. If you think you need to go to your doctor, you probably need to go to your doctor, get medical things ruled out to make sure it's not a medical problem, and if there is a sleep issue or a sleep referral that needs, and then more than likely you need to end up with your local psychologist.
What you're saying too is because I have a little soundbite I like to tell people is that sleep is like sex. That there's a lot of ways to mess it up, but there's a lot of ways to improve it too. And so
I'm feeling that.
Yeah. You got to clear the way for it to happen naturally and not force it and all that kind of stuff. So,
that's like, sorry, the soundbite of the day.
Speaking of that, you mentioned about reasonable expectations for functional kind of, gauging functional impairment. I was talking with Jill Elbracht, and she had a really good, interesting point about there's this fad with COVID about learning new languages and taking on these gigantic projects. And you alluded to this about home or working at home, and this is reasonable stuff. If you're trying to learn like the entire history of Russian language in a weekend and you're not able to do it because you're tired, that's not the same thing. So
sometimes it's you got to consider it a bonus if you got your undergarments on. I mean that.
Yeah. Ooh, that's a bonus for some people.
And that's one thing I say, make sure you get dressed every day. I don't care if it's fresh pajamas, but get dressed, get up and start your day. But these are unusual times. Have rules. And if you set rules, you're going to, we can't follow them.
At least set yourself up for potential failure. And
right.
And speaking of unique times, I know we have to wrap up here soon, but I did want to ask you about with your practice and also because, you and Stephanie started the integrated care practice over at Plus Medical with COVID and the impact of COVID and all the changes. How would you say it's impacted your practice roughly?
I miss my colleagues because we're all in little rooms with computers. I miss my colleagues. I didn't realize how frequently I have Plus Medical is a very huggy practice. I didn't realize how much we hug each other, and I miss that immensely. Doing integrated care is interesting when you've got 3 people on the computer and we're all calling in. It makes it coordinated care. It gives it a totally new meaning when you have to have your IT person coordinating patient and 2 providers, and providers, we are not always the best at listening. We already know. And so we're doing integrated care over the computer. And it's a challenge. I guess one thing in our practice I would say is most of us really miss that human contact. And it is so much better than being over a phone to have Zoom. But I would say most of us really miss interacting. My office is right next door to Dr. Harris, Brenna Harris, and we will go days and I'll be like, you're here. How are you? And our offices, you can't go to our offices without walking by each other. And so it has, I guess we've all kind of grown an appreciation for the face-to-face and the in contact and what you see. But I
Mm.
do appreciate the fact that people are willing to do Zoom so we can see them.
And what you're saying is you know, I had thinking about the situation about the silver linings and things, and the mental reservation for the future about when things clear up, like what those hugs are going to be like, and what like for me,
Mm-hmm.
and I know I probably shouldn't say this because there's talk about never handshaking ever again, but I miss shaking hands. Like I can't wait to do that and giving hugs and things like you're saying, because it's going to mean more, and so there's that level of appreciation when that comes back. Um,
Mm-hmm.
the Before we wrap up, if you're comfortable, I did also want to ask about kind of maybe for you personally how COVID's impacted you and your family.
Well, it's been interesting. My parents who live with me, who are in their mid 80s, are stuck in Florida.
Mm,
So I'm
wow,
kind of figuring out when I can go get them safely because they're in a hot zone. Um,
thanks.
have my son from college home and then my high schoolers home. They've decided they're going to get in rock star shape and put on 10 pounds of bulk. So
Good for them.
well, yeah, except they're drinking 8 gallons of milk a
Oh,
week.
it
Eight,
comes with the price. Yeah.
8
Wow.
gallons of milk. So it's like I have fun with my family. I like that we're here. Um, my daily life hasn't changed that much, but I have never spent this much time with my family. It's kind of reassuring that I like them.
Oh, that's lovely. I wasn't sure where
And
that was going to go. Yeah.
no, and I still like my husband, um, which is good. This
Yeah.
is cool after 25 years. I still
Mhm.
like the guy. And, you know, it's just this weird time, but I think as a psychologist, to be honest, we deal so much in the gray zone. Um, I'm probably more okay with this than the rest of my family. They get a little frustrated at times not being able to be out and do their social thing,
Mhm.
but um, I'm fine. But I think my family might be slowly losing it. I would
Yeah.
probably slowly losing it as well.
I do. I feel what you're saying about, you know, what we get paid for a living is to talk and interact intimately with people all day. Sometimes I'm like you. I'm okay with being home. So this is
Yeah.
well, Leslie, this has been great. Thank you so much for the interview. I really appreciate it.
Thank you so much for doing this.
It's been fun. This was really fun.
Have a good one.
All right, you too. Take care.